Hi guys, welcome back to my channel and thank you so much for the love that you're showing me. We're continuing with a series of pregnancy, and once again I have a gentleman and he can introduce himself.
Thank you, Linda. My name is Dr. Kelvin. Last time I said Chief Pharmacist. So, Chief Pharmacist, Checkups Medical Center. Yes, and thank you for having me again.
Welcome. So today we're going to talk about something that is actually affecting very many pregnant women. We're going to talk about preeclampsia and eclampsia, which is just basically high blood pressure during pregnancy. And we will start by WHO facts. Daktari will take us through them so that you can actually see the magnitude of the issue that we're talking about. So Daktari, you can shed light on that.
Thank you, Linda. It is fascinating to note that the WHO places preeclampsia at a quite high level, where we are saying that close to 4.6%, and this can go as high as 10% of all pregnant women would suffer preeclampsia.
Yeah, so you can see that is just a very, very high population of ladies that suffer from preeclampsia or eclampsia and they don't know. So we're just talking like this preeclampsia and eclampsia. And I know people in my audience, you don't even know what this is. So, Daktari, what is eclampsia? What is preeclampsia?
All right, thank you. I'll start with preeclampsia, and I think you'd mentioned briefly about it for the lay persons, that it's really elevated blood pressures in pregnancy. But it's important, if you now want to differentiate that with your usual hypertension, then it's important to note that preeclampsia is when your blood pressures, the systolic and the diastolic pressures, are above 140 and above 90 past the 20th week of pregnancy. So beyond 20 weeks of pregnancy, that's oftentimes where it starts, where you are midway. Yeah, and then that we term preeclampsia. Of course, like any other hypertension disorder, then we have to do multiple readings before we diagnose you as such.
Yeah, okay. So there's someone who's watching and they've just had me saying now eclampsia. What is now eclampsia, and how do you differentiate preeclampsia from eclampsia?
All right. Thank you, Linda. I'd say eclampsia is when things get really bad. Yeah. Preeclampsia is that it's bad news. Yeah, but we're not quite in the thick of things yet. Eclampsia now is when the lady, as a complication, also develops generalized tonic-clonic seizures where they're even shaking. And this is after we've ruled out any other cause that would cause them to have seizures in that.
Yeah, so in simple terms, preeclampsia is just hypertension in pregnancy, and then eclampsia, now it's hypertension. Now you have other signs and symptoms like now seizures. Yeah, so what can really cause someone to develop maybe preeclampsia or eclampsia, so that if there's anyone who's watching and she's pregnant, then she can be able to take care of herself and avoid some risks.
Okay,
yeah. Thank
you, Linda. Once again, I think before I do that, there's a very important aspect that goes into the definition of preeclampsia that I did not mention. We've talked about the elevated blood pressures above the 140 and the lower readings above 90, but then the other important aspect that we tie preeclampsia definition to is the presence of protein in urine.
Yes.
The proteinuria, or in the absence of protein, because sometimes the hypertension occurs without the proteins in urine, any other signs of end organ damage. So either we are seeing signs of your liver suffering, or kidney damage, or neurological complications, like we start talking about eclampsia.
Yeah.
Okay?
Yeah.
That's it. So there are a variety of risk factors, and some we can't quite tell why that happens, but something that is very significant that we see a lot of is null parity, where we are saying that women who they're having a child for the first time tend to be at a higher risk of getting preeclampsia.
Oh, so does it mean that when I'll be having my first child, I'll be more predisposed to getting preeclampsia compared to someone who's had actually children?
Yeah, data seems to suggest that women who are having kids for the first time are at a higher risk of that.
Oh, wow.
Yes. Okay. There is an aspect of genetics where if your mom or if preeclampsia runs in your family, then there is a high likelihood that you would also suffer the same during one or multiple of your pregnancies. Okay?
Yeah.
The other risk factor really is if you've had a history before of preeclampsia. So with subsequent pregnancies, that could also, it's highly likely that you would suffer the same. The other thing that we are seeing data supporting is that for women who are carrying multiple pregnancies at the same time, so women who have twins, who have triplets, there is a high likelihood that they would suffer from preeclampsia, mostly because of the hemodynamic changes that come with
the multiple
pregnancies. Okay, so that's one thing that we're also seeing a lot of. The other thing is really hypertension. So if you're hypertensive, chronic hypertension, and you're hypertensive even before you got pregnant, then there's a very high likelihood that you would suffer preeclampsia during your pregnancy. And someone might ask, now how do I tell if I was hypertensive, and now how do I tell that I've transitioned
from
to
now hypertension to
preeclampsia?
preeclampsia?
All right? And oftentimes for chronic hypertensives, what we see, again, remember the mark, 20th week, So we see that after the 20th week, this person was on their hypertensive meds. Of course, when you get pregnant, then we will have to switch you to a regimen that is pregnancy friendly. But we begin to notice that even on that pregnancy friendly regimen that you were previously controlled on, the pressures now become almost resistant to that regimen. And then as an addition, we start seeing the protein, or we start seeing some other signs of end organ damage. And that's where we transition you very quickly from just being a chronic hypertensive to bring someone who has preeclampsia.
Okay.
Yes, just to mention a few of the risk factors.
Okay, so you've mentioned now the risk factors. And why is it that we're talking about now preeclampsia? Does it have an effect on the mother or the baby? And if there are effects, what effects are those?
All right, thank you, Linda. I think I forgot to mention one thing that people have control over, because I've mentioned most things that they do not have control over as risk factors. But really we've seen diabetes, pre-gestational diabetes, that is you are diabetic before the pregnancy, and obese patients, we're seeing a lot of those having preeclampsia as well. So obesity pretty much is a risk factor for most things.
Most diseases, exactly. And that's why I always say it's important for you to live a healthy lifestyle, exercise and eat well. You'll avoid all these things.
Yes. All right. So now to what preeclampsia, why it is such a big concern to us, is what will happen to this lady who suffers preeclampsia. So one thing that is very important is that preeclampsia has been associated with an effect on the fetus, and then I'll talk about what it does to the mom. Okay? So to the fetus, we have seen that women who have preeclampsia tend to have reduced volumes of your amniotic fluid, really, and the circulation and the supply of blood to the fetus and to the placenta is affected, and that is really
risky.
The baseline of preeclampsia, and it's very risky. So what we see is that there is, to some extent, fetal growth retardation, where the babies do not develop or mature to the extent that we would want. Okay? And for the mom, what we are seeing, remember we said that preeclampsia is either you have proteinuria or you start suffering or showing signs and symptoms of end organ damage. When I talk about end organ damage, we're talking about your kidneys shutting down because they are not also getting enough supply of blood, and that is what happens with hypertension. You would expect that because the blood is flowing very quickly at very high pressures, it gets to supply all organs. But in such circumstances, it is shifted to the vital organs, and some of our main organs begin to suffer eventually. So we are seeing people now, the mother is at risk of chronic kidney disease and kidney failure. And when your kidney shuts down, then the rest of your body begins to suffer and your wastes build up. The other thing that we are seeing that the mother is at risk of is really liver damage. And maybe sometime in future we can talk about HELP as another subtype of preeclampsia and complication related. But really the livers begin to suffer, and so we start seeing your liver enzymes going up in distress, just to warn you of that. The other thing is that the mom is even at risk of stroke, just like any other hypertension. And then they are at risk of even other neurologic complications as a result of that, where we are seeing women now get the eclampsia, the seizures that we were talking about. Some of them start suffering very bad headaches, very bad scotomas. Scotomas is when you're seeing spots of light. It's almost light and dark, light and dark. Yeah, it's almost like blinking rapidly. Yes.
Yeah. So now you've seen how like pre-eclampsia and eclampsia have a very like negative effect towards the mother and the fetus, and that's why it's important for you to attend those ANC clinics so that they can actually check your blood pressure, and if there's an issue with it, they arrest it there and then before it now magnifies and becomes a big problem. So after now we've seen now the effect. Is it preventable and is it treatable? And yeah, if there's someone out there who's actually suffering from eclampsia or preeclampsia, what can you tell them about the treatment and prevention?
All right.
Yeah.
Thank you, Linda, once again. I'd say preeclampsia is pretty much manageable. Yeah. Treatment is not the best one to use. Yeah. But management would be more accurate. So yes, it's possible to manage preeclampsia and even prevent you from getting to eclampsia. The easiest way for us to do this is please keep your ANC clinics, like Linda is saying, because it's only then that we will do your baseline blood pressures, and somewhere along the pregnancy at the 20th week we have some numbers to compare to also be able to tell if you're at risk or if you've really gotten preeclampsia. So first, what we have control over is keeping the ANC clinics, and they will ask you to give your urine. Please give that voluntarily. We are checking for the protein levels. We want to see if your kidneys are functioning well. All right. The other thing really is medication, and I won't bore you with the jargon of, oh, this is the medication we use, but yes, there are medications that once we figure out that you have preeclampsia, then we put you on them immediately. And this is really just to make sure that your pressures are controlled to levels that are not detrimental to your organs and not detrimental to the baby as well. Okay? The third option, and this will be a journey with your OBGYN,
your gynecologist.
Sometimes you get lost in this.
I get.
The journey will be to decide when are we going to deliver this baby, okay? Because sometimes, really, because preeclampsia is a problem associated with pregnancy, sometimes delivering the fetus is the treatment, and ideally it needs to resolve within 12 weeks of you delivering. The pressure should have gone back to normal. If it doesn't, then we start talking about you having chronic hypertension. Yes, but those would be briefly the three options that are available.
Okay. Yeah, so I hope you've learned a lot about this. Personally, I've learned a lot, and the fact that just delivering the baby can be a cure to you. And that time, maybe sometimes we find out that patients like who have preeclampsia or eclampsia usually give birth earlier than the rest of them. So also prematurity, it's also another issue on its own. It's really, really good that you take care of yourself. And make sure as a pregnant mother, please attend your antenatal clinics. It's important because I know some people, they just like sit and wait for the time to deliver and then they go. So I'll do an exclusive video on the importance of antenatal clinic visits so that you actually see the whole spectrum of what I'm talking about. I hope you liked this video. I hope you enjoyed it, and I hope you learned something new. And if you like this video, if you have any questions, please leave them in the comment section. If you have any question with regards to anything relating to pregnancy, because I'm covering the whole of pregnancy series, please leave everything in the comment section and let us always interact. Please like this video, give it a thumbs up, and make sure you subscribe to this channel. Share it out, share this video, because I know like more people are learning and we're growing. Thanks so much for that. So yeah, have a nice time. I'll see you in the next video. Bye.
Bye.